September is National Hospice and Palliative Care Month. Here in West Tennessee, we take this time to celebrate our team and recognize Hospice of West Tennessee, highlighting what we offer and how we can benefit our community. This year, we're highlighting Dr. Stephanie Anderson, our new medical director. She wanted to have different patient voices speaking about what Hospice of West Tennessee means to them, and that includes family of those willing to share. Today, I have with me Teresa Freeman. She is the Vice President, Chief Nursing Officer at Jackson-Madison County General Hospital, who was recently the winner of Tennessee Hospital Association's Senior Executive of Distinction Award. Thanks for being here, Teresa.
Thanks. Glad to be here today.
So what we want to do today, we want to get a testimonial from you of what Hospice of West Tennessee means to you.
So I recently had an opportunity to work with Hospice of Tennessee as the daughter of a patient. My mom had been diagnosed with a terminal illness about 8 years ago and actually did very well through the first few years of the diagnosis. Initially, physicians told her that she probably only had about 2 to 3 years to live. But as I said, she was able to hang on for an additional 8 years. For the last 8 months of her life, though, we did have assistance from hospice, and it was truly a godsend to our family. Hospice is a wonderful service. They not only care for the patient, they take care of the entire family. All of the staff was just incredible. I have never experienced individuals that consistently showed so much love and patience. They listened, they encouraged, they never hurried through the visits. And something that was very important to our family, they actually took the time to pray with us.
And especially, this is a situation that, many people go through. This is definitely a difficult time in their life. How would you speak to, what do you think would have happened had this service not been available to you?
It might have meant that we had to find placement for my mom. As it was, we were able to keep her at home throughout her illness. And she was able to stay with family or have family there with her and be in an environment that was comfortable to her. And that was only because we had the support of hospice. We had a nurse that came in twice a week, more often if we needed her. We had assistants that came in and helped with her hygiene needs. All of her medications were taken care of. Basically anything that we needed, hospice took care of. And again, that allowed the family to focus on the day-to-day overall care of mom, and we were able to keep her at home. And again, we just would not have been able to do that without hospice care.
Right. And especially for the community of West Tennessee, how important would you say it is for many families in this area to have this Hospice of West Tennessee, in their own community? It's
vitally important. Both hospices and palliative care both are something that honestly need to be better utilized in this community. It's something that those words are things that usually scare people, scare families and patients. They equate those two phrases, palliative care or hospice, with death. And that's not what it is. It's about support. It's about love. It's about providing families and patients those things they need at the end of life. So it's not something that people should be afraid of. It is a service that I hope the community will absolutely embrace and understand that it is there when you need it.
Great. And my last question is for those in the community that may not be familiar with Hospice of West Tennessee, even some employees of West Tennessee Healthcare. With this month, we're trying to recognize and highlight. What would you say to those people who maybe aren't familiar with it, and how can they get in touch?
Well, the first thing you need to do is talk to your primary care physician. The individual that is providing the care, they're going to be the ones that will help you reach out to hospice services and make that available. From that point, hospice will contact you. I don't want to speak for Tara, who is the director of our hospice department or that service, but that's how it worked for us. My mom's primary care physician reached out to hospice. They contacted us, and then immediately within just a couple of days had us set up with a hospital bed, medications being sent to the home, oxygen in the home. And again, we're working with us and working around our schedules to get nursing visits, tech visits, pastoral care, case management, and all of those other things that we needed. But it started with a conversation with the primary care physician.
Right. Now, is there anything you want to share about an experience you had or anybody you want to highlight?
Well, a couple of people a lady named Nancy was my mom's primary nurse throughout her hospice care. And again, Nancy was incredible. She contacted me every day that she visited my mom, I got a call and we discussed what the care plan was. Towards the end, when I was staying with my mom, obviously Nancy and I were having face-to-face conversations, but she always kept me involved in that care. Demetrius was the tech that came out and did my mom's hygiene care, and she knew how much my mom loved having her hair washed and then getting it rolled. And so she always made sure that she took the time to do that. And I heard Demetrius say on more than one occasion when mom said, "No, I don't want to trouble you," Demetrius always told her, "That's why I'm here. I'm here to take care of you." And that's the way they always made us feel.
That's great. That's great to hear. Well, thank you so much, Teresa, for coming on. And I want to say another congratulations to you on winning your Senior Executive of Distinction Award.
Thank you. Like anybody, it's only as good as the team that you have around you. And being part of the West Tennessee Healthcare family, I do have an incredible team, an incredible family of support here.
Absolutely. Well, thank you so much for coming on and giving your testimonial about this very important service that we have here in West Tennessee.
Absolutely. I firmly believe in hospice and palliative care, and it's something that our community does need to be aware of.
Great.
So thank you very much.
Thank you so much. And now for this next interview, I have with me Cindy Roberson. Thank you so much for being here, Cindy.
Thank you for having me.
Yes. So we're talking about Hospice of West Tennessee, and thank you so much for coming on and giving us a family member's perspective on our hospice services. Give me a little bit of information about yourself, Cindy.
Okay. Well, I'm from Jackson. I'm actually a psychiatric nurse practitioner, and I work in the West Tennessee healthcare system. I've been with West Tennessee Healthcare for 24 years.
Oh, wow.
And got introduced to, knew what hospice was. I'm a nurse. I knew basically what hospice was, or I thought I did. And then this past summer, my mom got, the diagnosis no one wants to ever hear, but her colon cancer from 7 years ago had metastasized to her liver. And she made the choice that she, wanted to stay home and how she wanted us to move forward with that. And so when she ended up in the hospital in August, that was when the doctors came around and talked to us about hospice care.
Now, you knew about hospice, but did you know about Hospice of West Tennessee? Had you heard about that, within this community here in Jackson?
I knew that there was, there was hospice available, and, because I had worked in the system, I knew we had that service, but I had, never really used it. So I didn't really understand everything that it encompassed until, we were enrolled and we were utilizing the service. And then I just was amazed at, what all they did to help people with their loved ones, and how I was able to carry out mom's wishes, because I had their help. It was amazing.
Right. And now, so we definitely want to make sure that people within the community are aware that this service is there. Not many people do know about it. So you said it was last summer that your mother was entered into it, or this past summer?
Yes, just this past summer, just August of 23.
Oh, okay.
Mm-hmm. Yeah.
So what can it bring me through? Like, what was the process like when you were first introduced to the idea of hospice? Kind of how did the process go getting her situated in it?
Right. Well, we were in the hospital for just some, complications, trying to get, her comfortable and settled with those. And then we were talking about, there was no real need for her to stay in the hospital because everything she needed we could do at home. And that was what she, had wanted if it was possible. And of course, I wanted to do that for her. So we reached out. Dr. Wright was the oncologist. He came over and kind of told us, what the options were. And of course, I knew the basics of what hospice was. So I just kind of, when I found out that West Tennessee Healthcare had that service, I was like, okay, well, if this means I can go home and if she can go home and I can help take care of her there, well, then, sure, we'll sign up for this. And so they sent around a representative, and basically we just kind of went through, an admission process. We got everything set up like in the hospital. So we did all the paperwork and met the admission nurse and everything in the hospital. And so when we went home, we were already enrolled, we were set up, and then the services just like they started immediately.
Okay. Now, how did that change? Did it change your perspective on maybe what you already kind of? Because I feel like a lot of people have a idea of what
Yeah, I
hospice
mean,
is in their mind. Having been through it,
right.
what
You
changed? Yeah.
think it's going to be, the very end of life. You
Mm-hmm.
think, oh, well, they'll be the ones there at the very end. And it really, I mean, mom was up and independent around the house, when she got home.
Mm-hmm.
So for me, it was these services came in. They had social workers and they had spiritual guidance. If you wanted it, nothing was ever pressured.
Okay.
But they just had so many resources. And then the thing that I think really stuck out to me was how, because they kind of know the process, those end stages of life, they were
Right.
able to kind of predict what we would need before, we even realized we were going to need it.
Okay.
I'm a nurse, so I knew the basic medical things and, that kind of, but I can remember, just like maybe a week or so before mom needed it, the nurse had recommended and sent out oxygen, so it was already there. The day that we needed to put it on, it was already there.
Okay.
The medications were sent right to the door. We didn't have to, if there was a med change or we needed to get medications for mom, I mean, they came right to the house. I didn't have to leave her and go get anything. The medical supplies that they brought out were just anything to make her more comfortable. And then in turn, that made it easier for me because we had everything we needed. So, and when you're in the middle of that stress, you're even if you're medical, you're not thinking like a nurse. You're a daughter or
And
a family
especially,
member.
when it's a very close loved one.
Yeah. And that's not, when you're not familiar
Mm-hmm.
of trying to take care of someone at the home, you don't realize the things that you're going to need that you don't have, like when you're in the hospital.
Right.
So that was probably the biggest thing for me, was that they just anticipated our needs and never made us feel uncomfortable about asking questions or, what was coming down the road, if they could help us in any way. And I mean, I can't think of anything that we needed or had questions about that they weren't able to help us with in some form or fashion.
Right. And I mean, sounds like I know the answer to this question, but how do you think it would have been a different experience had you not had hospice during this process?
Absolutely. The nurse came out, and so she would check mom's physical needs, the medications, like I say, any changes like that. I didn't have to try to drive her to the doctor's office, because she was getting weaker and weaker as the weeks went on. And then they sent out people to help us bathe her. She was able to stay at home and do those things, wash her hair, without having to put her through the stress of trying to transport her somewhere, And then any kind of supplies, like I said, as things progress, a shower chair, a walker, any kind of hygiene supplies. I mean, they were just so great about what do you need? Have you thought about this? You might need this, making sure that we just had everything.
Right. And I must imagine, that takes a lot of stress off, because there would be things you wouldn't even think about.
Exactly.
Now, did any...
and they...
Oh, go ahead.
Anticipate... No, it's okay. They could, they kind of knew, so they were able to, anticipate it for you.
Now, did anything stand out to you that you didn't expect, or did anyone go above and beyond what your expectations were?
Well, I didn't have high expectations. I mean, I knew they were just, I just knew they were coming in to help us. And so it was really so special to just have those services and those resources and everyone just reaching out to try to make such a harsh, horrible time something that we could relax and just enjoy the time we had with mom,
right,
without having to worry about the other parts. Nancy Bowe was mom. She was the main RN that came. And, when we had any kind of question about how mom was doing physically, Nancy would come out. She was so kind and so sweet, and really just tried to make mom comfortable, and was just really precious with our whole family.
Right.
Because the patient is so much, but there was so many of mom's friends in and out and family. And and hospice just embraced everybody that came in. And Nancy was just so gracious to talk to everyone and took her time making sure that we were all okay.
Great, yeah. Now, my last question would be, now I don't know if you have encountered anyone and you've already given any advice, or what would you say to someone considering reaching out to hospice here in West Tennessee for one of their loved ones, or if it has been suggested to them by a provider, kind of what advice would you give them?
I would say definitely talk to them. It's not a pressure, they definitely don't pressure you into anything.
That's good, yeah.
But they can just kind of tell you all the different services that they have available. And it can really help you. It could help you make a decision on whether or not you feel like you're capable to keep someone maybe at home rather than another type of facility. Having their support meant that I could keep mom at home. I think without their support, without West Tennessee Hospice, I think we probably would have had to found outside care. And she was so much more comfortable at home in her own bed, So I would tell anybody to talk to them, at least talk to them, get the information.
Right. At least do a consult. Cause
right. And
definitely available.
Because we had talked about hospice way ahead of time, but then we didn't realize when we ended up in the hospital, how fast it moved along.
Oh, yeah. And I imagine.
So I was glad, that they came in and were able to explain it to us, because it's very, in this day and age with all of the medical, things that go on when you're taking care of someone, it can get really confusing
and overwhelming. Yeah, I definitely.
Yeah, but they're like this one entity that just kind of takes you through it all the way from the time mom went home and she was still independent all the way up until the very end to the night that she died. Actually, I was able to call. And the nurse came out, there to our home. And they just make you comfortable in a time where you don't want to be thinking about anything else.
Right. Well, thank you so much, Cindy, for coming on and giving us your experience. And hopefully with this testimonial, we're hoping that maybe this can reach someone who's maybe considering or has been told by a provider that this is something they may need to consider, that this can help them out with that.
Right. And I would say, too, one of the things they told us up front was that there's really not a time constraint. You never know how long you're going to need the services. And so that was one thing I was afraid to start them too soon or, and they were just really open about don't feel pressured about the time. And
it's not a set time.
It takes a load off. Yeah. Right. And so that they would be there no matter what. And so I can't imagine going through those rough times at the end without them. And I know Mom really appreciated it.
Yes, definitely. Well, thank you so much for sharing.
Yeah, you're welcome.
Yeah, thank you. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.